Hello, Vanessa.
Hello.
Hello. I know you come from the St. George University. Can you introduce some more about the university?
Okay, great. Thank you for inviting me. I work for St George's University of London, into St George's University of London, and we are a school that offers fantastic opportunities to study medicine. We're a specialist school because we offer medicine, biomedical science degree programs in a hospital setting, so it's quite exciting. And these are degree programs that will allow students who want to become medical doctors or biomedical scientists and be the best that they can be, either in the UK, in the US, or anywhere else in the world.
I know you provide service pathway for the student becoming a doctor. Can you give me some more detail about the student, how become to the doctor?
Sure. So we have different entry routes into our program. Now, as you can imagine, medicine is our most popular program here at St George's.
Yes.
And for that student, we ask students who have the HKDSE to have grade 5, four grades at grade 5, including biology and chemistry.
So the student must have the biology and chemistry is a separate subjects.
Yes.
Singles.
Yes.
Okay.
And then we also ask students to take what's called a UK CAT test. It's a clinical aptitude test for those students who want to become medical doctors, and they can take that here in Hong Kong. Fortunately, so if they have 500 in their UK CAT test in every paper, plus their results from the HKDSE, we will give these students a guaranteed interview. So if they pass the interview, they will start here in year 1. So they'll do the first year of medicine, which is understanding the principles of medicine. Doing 6 weeks of clinical placement in our UK hospitals. In year 2, they will do something similar as well. In year 3, they take everything they've learnt in these 2 years and put it into clinical training here. So they spend 18 weeks doing clinical training in UK hospitals, which is very exciting for the students to be working alongside doctors, or as themselves pretending to be mini doctors working with patients. In the 4th year, we give the students a biomedical science degree, a BSc here, so they become a biomedical scientist. And then the last 2 years is focused heavily on just clinical placements. Now, as I mentioned, our program is exciting because we give students the opportunity to study abroad. In year 5, students are able to go to the University of Jordan in the Middle East to spend 42 weeks in hospitals there doing clinical training. In their final year, in year 6, they get to go to the University Washington Adventist, so Washington Adventist Hospital, spending 36 weeks doing clinical training there. And then they graduate and become a medical doctor.
Become a doctor, the first pathway, become a doctor.
Yes, this is the first pathway.
How about the second one?
We also have a fantastic program called Biomedical Science. This is a program for students who are interested in being a biomedical scientist, so students who like science, understanding the medicine behind it. It's a 3-year degree program taught on our St George's campus, and the student, if you do really well in this program, you could possibly transfer into medicine. So you'll do year 1, year 2, year 3 and become a biomedical scientist. And you'll transfer to year 4, which will be the clinical transition year. So that's very similar to this year in year 3 for the other undergraduate students in medicine. So again, they spend 18 weeks doing clinical placements. So it's really taking everything they've learnt here and putting it into clinical training here. And just like the medical students in year 5 and year 6, they will go off to study abroad to learn medicine in other international destinations before becoming a doctor. So these are the pathways into medicine, really. There's like 3 different routes and all leading to the same destination.
More chance to students become a doctor.
Yes.
Thank you, Vanessa.
You're welcome.
Thank you.